The family of 36-year-old Dr. Antony Buhangamaiso is running a fundraising campaign to raise 150 million shillings for an urgent kidney transplant following a year of treatment now.
Along the way during my master's program, I became hypertensive and started taking antihypertensives under prescription of a doctor. Later, I started seeing changes in my body, changes in my mood, changes in the way I'm doing my work, body swelling, and I thought it is this whole diabetes and hypertension. But later, I kept deteriorating until a point when the renal failure could not allow me to do anything.
Dr. Buhangamaiso says the condition has not only stopped him from practicing his profession as a surgeon, he's also unable to serve as breadwinner for his family.
We want to pursue the transplant. So we are in a journey of raising funds, about 150 million shillings. And then also, we also want to do it as soon as possible. I myself am becoming weaker and weaker as the days go by.
His wife, Martha Namugabo, has also seen her work disrupted to take care of her husband. She drives him from their home in Hoima to Chirudu Hospital in Kampala every 3 days in a week to have his blood cleaned of waste, a procedure medically known as dialysis.
You can spend the whole night seated because he's not well. So it's a very long, tiring process.
Dr. Buhangamaiso is only part of a larger country statistics. Professor Frank Asimwe, a urology specialist, says over 300 patients are receiving treatment at various hospitals around the country. However, not all of them can be scheduled for kidney transplant procedures.
Of those whose kidneys have failed, only about half may be fit for transplant, because not everyone whose kidney has failed must get a new kidney. They are either too sick to benefit, or they have got other comorbidities, or they are too old.
Uganda recently enacted a law to support organ donation and transplantation, which would be of relief to the many patients waiting for such surgeries. However, the wait will take a little longer for such to happen at the expense of the sick.
We're going to start largely with related donors, and the related donors, we are interested in first-degree relations, that is siblings of the person who needs the kidney, parents or children. Because the more closely related, the less the possibility of rejection. So to maximize our success, we're going to begin with the closely related first-degree donors, and then slowly, as the program takes off, we can open up.
In Uganda, the doctor-to-patient ratio stands at about 1 doctor for every 20,000 patients. Now, in a situation where you have Dr. Buhangamaiso unable to perform his duties, it may literally speak to say that 20,000 patients will miss out at a service he started to offer. But the big question remains, when will this country offer specialized and affordable health care to its citizens? Walter Mwesije, NTV, Kampala.